Hi, this is Dr. Michelle May. I'm the founder of Am I Hungry Mindful Eating programs and training. And this is part of an educational series for health and wellness professionals who are interested in learning more about mindful eating. So today we're going to have a conversation with Megrette Fletcher. She and I co-wrote Eat What You Love What You Eat with Diabetes and developed the Am I Hungry Mindful Eating for Diabetes program. What you may not know about Megrette is that she co-founded the Center for Mindful Eating way before mindful eating was a thing and really was, I think, has really been a pioneer in this field, especially in bringing mindful eating to diabetes. And so I wanted to invite her here as a diabetes expert to really talk with us about why mindful eating can be such a benefit to people who have a chronic condition like diabetes.
Mindfulness is a skill. So being able to drop into the present moment, to let the clutter of our busy minds go, it's a skill. And the more you practice that skill, the easier it becomes, the more instinctual. It becomes kind of the new norm. And when we do that, we start saying, oh, the new norm is I'm aware versus vigilant of my food choices. And it's a comfortable, flexible awareness. It's a compassionate awareness. And as we do that and we start, practicing that, we say, hey, I understand what the difference is between dieting, which, really isn't what mindful eating is about. And I understand how mindfulness or awareness and that non-judgmental, compassionate awareness that we put ourselves in the center. It's really us. We're saying, I really want to take care of me in this moment. What is this? Where are the opportunities in this moment? And it's these micro choices. And so many times people will say to me, yeah, but it's like not a big overhaul. It's like not like a big plan. And I go, no, it's really not. It's really very sustainable. It's so subtle. It's so obvious. It's almost like we skip over it. And that to me means a lot because the present moment is seemingly so insignificant. We jump into the future or we go back to the past. And yet the present moment is where life happens.
Yes. And when you have a condition like diabetes that isn't going to go away, your life is a series of present moments. And so when you can choose to live in that moment and make the choices that are optimal for you in terms of self care in that moment, then it is much more sustainable. I think so often people come with a lot of baggage, a lot of fear, a lot of threats, a lot of worries about what their life is going to look like with diabetes, a lot of rules and misinformation and myths.
Fear does not motivate us. It's not a motivator. No matter how much we want it to be a motivator, no matter how much our brain thinks like, oh, I'll just make myself afraid and then I'll change, it doesn't work. And all the research is saying acceptance actually is the thing that helps us heal, is when we can accept a situation, when we can really lean in and say, this is my present moment. What do I want to do about it? What are the options that are available to me? What resources do I have at my fingertips? That's actually when change happens. So if I amplify, magnify, or impart fear in any point, I decrease the likelihood of sustainable change happening. But if I amplify, I magnify, or I encourage or facilitate people to reach into their own ability, into their own resources, into their own insights, I actually amplify change. I'm more likely to get change.
What we've seen as we've worked to help people who have diabetes apply these concepts to their own diabetes self management is that instead of trying, usually ineffectively, to follow rigid rules, they learn how to use their own awareness, their own curiosity, their ability to learn from mistakes to actually begin to manage their diabetes in a way that is, dare I say, fun, like actually sort of interesting instead of a chore and something to be dreaded and feel bad about.
And we have to start deprogramming all of this judgment. And when we start with mindfulness and say, it's not about right or wrong. It is about the present moment. How can I be here? What would help my body? What's the thing that I need right now in this moment? We're shifting the conversation from this binary view to this one of compassion, to this one of non-judgment, to this one of practice. We're not trying to get things right. It's not a one and done. It's a practice. It's a returning.
Well, I know a lot of the health and wellness professionals who are listening to you can feel the truth in what you're saying. I mean, if they've been in practice for any period of time at all, they know that perfection is not possible and thankfully not necessary. And so what you're saying here just sounds true. But don't you often hear the same question that I do, which is, yeah, but they have diabetes, and if they eat carbohydrates, it's going to raise their blood sugar. How do you use a non-diet approach, or how can you be gentle with nutrition when the consequences are so significant? What do you say to that, Megrette?
Sometimes we have to unlearn not only our learning, so we have to unlearn a lot of learning, but we also have to unlearn judgment. And I think that that's a really important part of um, mindfulness and mindful eating programs is how can we be non-judgmental, compassionately? How can we turn around and say, oh, food is food, not food is X, not food is Y. So there's so much of our binary thinking, it's good, it's bad, it's right, it's wrong, I'm good, I'm bad, I'm right, I'm wrong. We have to unlearn that process. But what we do know is that eating on a regular basis and a nourished body works better, and moving our body and taking our medications and getting regular medical care and understanding how to reduce risk and understanding, how to prevent problems and what is my medical appointment looking like, and having honest conversations with our providers. All of that stuff actually does work. And I shouldn't be afraid to go to the doctor. I shouldn't be afraid to check my blood sugars. I shouldn't be afraid to enjoy my lunch. Those are the barriers that we have to overcome.
Mm. Yes. Yes, because this isn't something that you're doing short term. The very first time we met, I think I was speaking at a conference, and you came up to me afterward and said, Michelle, a lot of the people that I work with who have diabetes have been chronic yo-yo dieting forever." I think your term was they're yo-yo dieters all grown up. In other words, they'd been there, done that, had tried that many times. And so somehow this idea that, well, now that you have diabetes, now you'll be able to follow some rigid diet permanently, it really doesn't work. And you're absolutely right. Fear is not a good long-term motivator, maybe short-term, which fools us all into thinking, well, it did work, I'm the one who failed, which isn't the case at all. If it's not sustainable, then it didn't work. So what about the misunderstanding? I mean, our book is called Eat What You Love What You Eat with Diabetes. What do you say when somebody says, "What do you mean eat what you love? That's how I got diabetes," which of course is not true, but what do you say to that?
Right. Well, diet culture is something that's so prevalent in our society. It's the water we swim in. So we don't know that we're swimming in diet culture. And it kind of, I think, speaks to that. So when we talk about loving food, you get to love food. You get to have foods you like. You get to have your favorite foods. You get to have things that you look forward to. Food is a pleasure. It's a huge joy. And there is no, I don't think any sane person in the world would want to take that joy away from everybody. That just doesn't make any sense. But we recognize that when we think about food and eating, we are struck by this culture that says less is best, less is better, less is right. And instead of turning around and saying, eating and choosing what I need is best, selecting foods that I like that nourish my body is best. We're not getting that message. We're getting less, smaller, reduce, restrict, avoid, limit. We're getting all of these diet messages, and that's the loudest voice. So it takes a very courageous person to hear behind that diet noise, to really listen to that part of themselves that's saying, yeah, I got to get out of this diet culture water because it doesn't help me. And it's the same old repackaged for over 100 years.
Well, and it goes back to the duality that you were talking about earlier, because it not only is that unsustainable, but when people aren't able to sustain a really rigid approach, they often swing completely in the opposite direction. It's not like, well, that didn't work, I'm going to go back to balance. No, no, it's that didn't work, I'm going to go back to ignoring it all and not checking my blood sugars and not paying attention. And so a lot of what we're doing is helping people move away from that all or nothing thinking to really, as you said, how can I, in this present moment, take in the information available to me and then make a decision that feels right for me in this moment?
Right. And just like you're saying, what feels right for me in this moment is a very different goal than what's perfect
Mm,
or what will please other people.
mm,
When we listen and learn how to listen, that's that mindfulness. We're aware of what our body needs, what we need emotionally, what we need physically, what would really nourish and nurture our being. As we get attuned to that wisdom, good things happen.
We offer training for health and wellness professionals in our Mindful Eating for Diabetes program. And I'm curious about what you would say to somebody who is thinking about doing some additional training, but maybe thinks, well, what am I going to learn that's new? I've been doing this for years, or, there's nothing new under the sun. How will this make a difference? What would you say to that person?
So mindfulness is not new. So I would say, nope, it's not new. The present moment has always been here. So if we're looking for something that's really solid and stood the test of time, I would say mindfulness is an awareness would probably fit, that's a checkbox. But us applying it, that's new. What I really like about the program that you and I created is it's so comprehensive and it really allows professionals to understand the different components. How does this connect to that? Oh, how could I say it this way? Now, one of the things about learning and about in teaching, they're different things. So one is we need to learn and one is we need to teach. And that confuses a lot of professionals. Oh, I know that. Terrific. That's wonderful. How do you get that concept out of your mouth so it goes into the brain of your client? That's a very different animal. But again, teaching and learning are not the same things. So having a program that says this is a way to help your client understand something is very different than do you understand the concept? And one of the things that I really find is that when I show people, oh, you could explain it in this way, they go, oh, light bulb moment. And I go, right. So our program, I think, is packed with those, oh, that's a really hard concept to get somebody to understand. And you did it so beautifully. It makes sense. It's so non-judgmental. It's honoring their experience and it's connecting with evidence-based practices, with the standards of care. So really navigating that process of elevating our counseling skills, and that's different than teaching skills. Elevating our counseling skills takes practice. Knowing what to say, that's learning. Being able to say it and really creating the space for our clients to receive it. Though they're three different things, and having a program that does all that, I think actually is really new and revolutionary.
And I appreciate that on a very personal level, because between the two of us, we've probably got 50 years of, of teaching. But I don't know about you, but I am still learning. Like, the program that I share today is very different from the original program I created over 20 years ago. My understanding of these concepts continually evolves. My understanding of how they land with people and what helps people, and also awareness of issues like social justice. I know you and I are very much on the same page in terms of using a weight neutral approach that really honors people in bodies of all sizes. Whether their weight changes or not is really not our business. And that's a very revolutionary thing to say in the field of diabetes, where everybody makes it about weight.
I do think it's really important to understand that health equity is a very complex issue. So when we talk about health equity, we are talking about everybody having access to care. In diabetes, we have health inequity. We do not see that same leveling of the playing field. And I think weight is unfortunately one of the root causes of that. And so when we start looking at diabetes, we have to acknowledge that there has been harm because of health inequities surrounding diabetes care. And we can see that they are tied to weight. If I say to someone, you're not a good person because of your size, I have created a stigmatizing experience. And I, as a practitioner, have demonstrated weight bias. And there's no benefit to either of those things, none. No one wins. I, as a provider, when I let that bias come out of my mouth, I am not effective. It doesn't meet my ethical codes. It doesn't meet my, my personal values. I'm here to help people. I'm not here to hurt. And yet I didn't do it intentionally, but that was the outcome. I hurt someone.
To be clear, most of the time, people aren't saying you're not a good person, but it's these microaggressions, it's these implications, it's these suggestions, it's these things that
Bias.
it's
It's the
bias.
it's the diet culture that we swim in. It's so rooted in our healthcare, and programs like the Am I Hungry are demonstrating it doesn't have to be. And that's really the key thing. So when people turn and say, can you make a non-judgmental, all-inclusive, program for people with diabetes? Yes, the Am I Hungry program did that. It's a wonderful example of how this can be done. And I think that as we move forward and start really talking about health equity and promoting health equity, we need programs like Am I Hungry?
I like what we were able to do by applying the mindful eating cycle, the different strategies and different ways of learning, and adding the additional component of diabetes education that does fit with the standards of care. And I like that we were able to still help people with nutrition and physical activity information, but from a non-restrictive, non-judgmental, non-binary approach. We're not saying don't eat this, this is bad, avoid this, red light, whatever the different terms that we see out there. And I find in the work with patients who have diabetes that it makes a huge difference for them to have the ability to look at their eating and simply make decisions, not judge their food or themselves based on the foods they choose. I think one of the other things that we did well, if I could say it that way, is adding a lot of experiential learning, having a lot of ways for people to learn. Would you talk a little bit about that? Because I know you also have a master's in education, so you are a true teacher and learner. So what is the benefit of that?
So many times when people come to meet with me or talk with me, they really are very passive in their learning. They're like, no, just tell me, but we don't really retain anything. I think it's 10% of what we hear, we actually remember. But when we do things, when we engage in activities, that's when the learning really can thrive. It can take root and grow. And so much of the Am I Hungry program is this engaged learning. We try to connect people's own experience with their own learning and try to weave in this. And I think that that's a big part of the Am I Hungry program, which, I think is just amazing and wonderful. And to have it all spelled out, this activity works really well here. This activity, try this, this is a good way of doing it. This is a great way of discussing it. Here's an interactive method by which you could teach this concept. So all of those things really enhance understanding. And ultimately, that's what it is. We need to understand, our clients need to understand, oh, what am I experiencing? Oh, I understand. Like when I'm experiencing this thing, a low blood sugar, I know what to do. Oh, when I'm experiencing hunger, I know what to do. Oh, when I see a warning flag for my diabetes, I know what to do. They're actually using the information to then take action, not fear. They're saying, oh, I'm an able, competent human. I know what to do. That is really what we're striving for.
Yes, yes, beautifully said. Beautifully said. It's called diabetes self-management for a reason. So we like to say we put the self back in self-management, which I think is so essential because no health professional is going to be following their patient around telling them what to do, and not that that would work anyway. So it really is truly about creating experts within. Thank you so much for your time. I really appreciate it. I think you have certainly over the years certainly helped me in my understanding and learning, and I continue to be amazed by the work that you're doing, and the work that we've done and how it affects people. So thank you so much for that, Megrette.
Thank you for having me.